Hello, good afternoon and welcome to this PANACEA webinar, which is part of our End User Virtual Workshop 2020. We're joined here this afternoon with our partners developing the Dynamic Risk Management Platform. To kick us off this afternoon, we've got our very smart coordinator, Dr. Med Sabina Magalini, who I will now pass the floor to for a brief welcome. Thank you, Sabina.
Thank you, Stephanie. Good afternoon. I am Sabina Magalini, an emergency surgeon from the Policlinico Gemelli of Rome. Our hospital is coordinating the PANACEA project that has the aim to deliver a set of people-centered cybersecurity solutions for healthcare. In my role of project coordinator, I would like to welcome you to this second end-user workshop with the intent to have a feedback on the tools we are building. As you know, this workshop deals with only one of the solutions. We thank all of you who are participating for the precious time you are spending with us and the extensive experience you will be bringing us. The suggestions and the evaluations that you will offer will be put to good use to fine-tune our tools to help hospitals with cybersecurity issues in these difficult times. Thank you very much and have a very nice end-user workshop.
Well, thank you very much, Sabina. I'm just going to show you, walk you through the agenda of the day, and then we'll do some presentations of our external participants whose feedback we really do value. Okay, so this is the workshop of the day, so we've already just heard from Sabina with the welcome. This is the agenda of the afternoon, so we'll be starting after this brief introduction also with the external attendees. We'll be launching, my colleague Christina will be launching the first polls on the stakeholder profiling. This should all be really straightforward for everybody. Then Pasquale Mari from the Gemelli Hospital in Rome will give a brief introduction to our partners from PANACEA, presenting the Dynamic Risk Management Platform. Then we will move on to the demo, and Pasquale will present the demos, the partners who are not in that previous session. And then we'll move on to the interactive session, where we'll have a brief introduction to all of the panelists, because we've got different partners involved in this particular session. And we'll start with a Q&A. So we'll be asking if the external expert participants have any questions specific about the tool or of what they've seen this afternoon. And then we'll use a series of live polls to collect your feedback and gather, and then have an open discussion on any key points that emerge from those polls. And then we'll be wrapping up where Pasquale will be wrapping up give us a wrap up on the next steps, and I will be giving you a few ways to keep interacting and connecting with PANACEA. So I need to actually, Christina, if you could just if you could just check. I'm just showing you now then the people who registered for the workshop. I'm not sure if they're already all online yet. What we did ask them to do is to just briefly introduce themselves, say who they are, who they work for, and their main interest in PANACEA. This shouldn't take too long to do, but Christina, I can't, because I'm on full screen, I can't actually see who the participants are. So do we have Arnie Banayosi online?
No, 11 people.
Okay, we'll move on and we'll see if people come in a little bit later on, we'll just come back to them. Moria Biliri?
No. Meanwhile, I'm giving the attendees the right to talk, so you can unmute your microphone when we call your name.
Yeah, perfect, yeah. Arno DeVos, I think I saw online at the beginning, so we could pass the floor to him. No?
Yes.
Okay, please go ahead and introduce yourself.
Θέλω 3 καφεδάκια. Θέλω ένα με ολίγη μαύρη και 2 μέτρα. prendo espresso.
I hear a lot of noise, but I'm not sure if you're hearing me.
Now we can hear you.
No, yeah, now we can hear you.
Now
yeah.
we can hear you, yes.
Yeah,
Okay, thank you. My name is Arnold de Vos. I'm the CISO of Triant, a large hospital organization in the Netherlands. I did not know of PANACEA before. Somehow I found it on the internet and I found the workshops interesting, especially this one on risk management. So that's why I'm participating.
Thanks very much, Elno. It's good to have you on board. Thank you very much. Andrew Hoyt, is Andrew online?
I think not yet.
Okay. Shrikant from the same organization, iData BV, the Netherlands.
No.
Okay, so we move on. Georgia Cougar.
No, not yet. I think many people still need to.
Yeah, they're still joining. We saw like a burst, and then Vissam. Is Vissam online?
Hello, Stephanie.
Hello, Vissam. Yeah, nice to speak to you.
Thank you a lot, Stephanie, for the invitation. So
Yeah.
this is Wissam Malouli from Multimage. Multimage is a small company located in Paris, and we are expert in cybersecurity. We are also involved in several European projects, and we are very interesting with the output of PANACEA, because there is a lot of interesting tools that are linked to cybersecurity, and one of them is this risk assessment and the risk management tool. Of course, I have a lot of ideas related to this kind of solutions for dynamic risk assessment, and I would like to see what is the innovation of this tool, and what you performed in this in the very nice project. So I hope this is okay as an introduction.
Thanks very much, Vissam. It's nice to connect with you again. Garik, is Garik online from Rinicom?
Yes, he's online.
Okay, the floor is yours. Thank you very much. Is he unmuted?
Yes.
Yeah. Oh, sorry. Yeah.
Don't worry. Yeah, welcome. Thank you.
Okay. I'll start again. Good afternoon.
Okay.
So I'm Garik from Rinicom. We are based in the UK, and we do secure communications. And among our portfolio is remote wireless patient monitoring systems. We have built in like a different authentication protocols in the system, as you do. This system are used in various hospitals and healthcare professionals around the world. But what we are finding is the traditional authentication methods are not working in the hospital environment, especially with the COVID, when the people are wearing, all the staff wearing the masks and all the protecting gear and so on. So we are very much interested in this aspect of PANACEA.
Yeah, certainly
and
had it.
Everything else what is happening in there.
Thank you very much, Garik. So the next person would be Sofiana.
Hello everyone, I'm from Sofiana from Unitech, and I'm very interested in this workshop regarding risk assessment because our company is highly related with these tasks and has another tool that works on this area. So I'm interested to see how the innovation of this tool can also work in this healthcare domain.
Thank you very much. Okay, so the next one, which I hope will be online, is Juan Mora. Is he there?
Yes, do you hear me?
Hello, yeah, welcome. Yes, we can hear
Hello.
you. Thanks very
Thank you. Hello. Well, I'm in the Curix project, and I work for the hospital of Portallero of Madrid, which has about 600 beds or more. And of course, we're in the Curix project, and we think there's a lot of common threads that we could explore and learn from PANACEA.
That's great news. Yeah, thanks. And yeah, let's try and have that as an important takeaway as a result of this session. Thank you very much.
Thanks.
Yeah, thank you. So the next person we should have is Tommy from the Olympia. I'm not sure he's connecting us from a long way away, so I'm not quite sure if he'll be online this afternoon.
Not yet.
Not yet. Okay, so we'll move on then to
meanwhile, Hani is online. Hani Balianti. Hi, Hani.
Yes, hi, good afternoon,
Ani,
everybody.
okay, let's go back to Ani then. Welcome, Hani. The floor is yours for a quick introduction.
Hi, good afternoon, everybody. This is Hani from Cyber Solace, based in London, UK, with a small cybersecurity advisory firm, typically focusing on the medium sector, private sector, also covering, alongside professional services, covering the medical startups. So I'm here to learn and share if I can, and really network with most of you. Thank you very much.
Yeah, lovely, super. Okay. So we got down to Christos from the National Technical University of Athens. Not sure if he's online.
Yes, he's online.
Okay. Yeah, the floor is yours, Christoph. Welcome. Thank you.
We can hear you very, very low. If you could get closer to the microphone or increase the volume. I think we can hear you now.
So I am Christos Danos from the National Technical University of Athens. I'm sort of representing the Sphinx project, which is basically doing similar things as PANACEA, and I'm here to learn.
I can hear a voice trying to speak to us, but you seem very far away. I mean, just feel free to shout at us, Christos. We won't be offended. Or if not, we can try again later on, okay? Because we could hear you really, really, really faintly. Would you like to try again? Oh.
Yes, just give me a second.
Yeah, we can hear you loud and clear now, Christos. Okay, good.
All right. So I'm Christos Danos from the National Technical University of Athens. I'm sort of representing the Sphinx project, which is doing similar things as PANACEA, and you've been to our meetings, and we've been to yours.
Okay, so another opportunity then to see how we can build on that early synergy then. Okay, that's good. We can pick this one up during the day and after this session. Okay, so the next person I have is Caxton from the UK and his colleague Manos. I'm not quite sure if either of or both of them are online.
This is good day, everyone. This is
Hello
from the University of Greenwich. I'm working with Manos based on cybersecurity risk management, and we're interested in this particular presentation because it's within the healthcare sector, and we are working within that space, and we'd like to see what is on board so that we can utilize that as well and make contributions as well.
Okay, very interesting. Thanks very much and welcome to you both. Okay.
Thank you.
The next person on the list is Ekuden Rios, who I've known for several years. I don't know if she's online.
Hello, this is
Hello
Ekuden.
there. Yeah.
Can you hear me?
Yes, we can.
Hello, I'm Ekuden.
Sorry, my mistake. I muted you by mistake, and now I can't unmute. I don't know why.
Can you hear me now?
Yes, sorry for the...
Hello. Okay, I will repeat. I'm Ekuden Rios. I'm working in the Basque Country for PANACEA Research Center. And I am involved in Sphinx project in the risk assessment part Okay, so I work with Christos in this part of the project, and I'm interested in not repeating, not creating the wheel again. So to learn in this session what is there, what is the state of the art, and what are the innovations you already have achieved, so we can improve in Sphinx our solution.
Steph, we can't hear you. We cannot hear you.
Can you hear me? I just finished my presentation. Okay.
I cannot hear Steph.
Okay.
Maybe we can go on with the presentation.
Oh, sorry, the panel disappeared. I couldn't get it back with my mic on. Sorry, thank you, I couldn't. So the next person should be Joanny, who is a colleague of Vissam. Did she manage to join us? Joanny, are you there?
Yes, hello, can you hear me?
Hello and welcome. Yeah.
Hello, thanks. Yes, as Wissam, I'm working in Montimash in Paris, and I found this project and the concepts and the tool that you are going to present very interesting in the context of one of the projects that we have here in Montimash. So thanks.
Yeah, thanks a lot and welcome again. The next person up should be Simon Woodworth. I hope that Simon's online. Are you with us, Simon?
No, we're not online, unfortunately.
Okay, well, we can map, as I said before, we'll go through anyone who joins a bit later on.
Hello,
the next person,
this is Don Slane. Simon will join us shortly.
Okay, perfect. Thanks a lot, Don, and welcome to you as well.
By the way, he's in Ireland, not the UK.
Right, okay, yes. Well, he put UK down as I was wondering myself. Yeah, it's fine. Yeah, we'll change that, Nick, don't worry. I'm more than happy to. Okay, maybe we could listen to Gabriele, sorry, from Software Centric Italy, if he's on the line.
Yeah, good afternoon.
Yeah, good afternoon to you.
I am since 32 years a designer and developer of medical devices, and mostly medical device software, particularly clinical data management and medical device data collection. So cybersecurity is definitely at the core of our concerns in all our activities. Thank you.
Thank you, Gabriele. I think, Stephanie, we cannot hear you again, but we can go on with Christos Xenakis, but maybe he didn't join. Okay, so we've finished with the presentation, unless anyone else joined in the meantime. I'm checking shortly.
Yeah, I think I've got back control on the screen, sorry. It's really sensitive and it disappears and appears and does things you don't want it to. Okay, I think we're ready to go. Christina, the floor is yours. We'll come back to anyone who joins later and we'll do another, we'll present them during the interactive part later on this afternoon. But I'll pass the floor now to you, Christina, for the 2 short live polls for the participants. Okay, thanks a lot.
Okay, thank you, Steph. So I'm now going to launch the first poll on stakeholders profiling. I read the question out loud and you will see it popping out on your screen. Then you can just select your type of organization. And so the question is, which type of organization are you representing? We will give you a few minutes to vote, and when all of you have voted, we will read the results. Okay, so the poll has been launched and you can start voting. Okay, 12 people out of 14 have voted, so I think we just missed 2 votes. We wait 2 more minutes for the 2 final votes to join the poll, and we'll read the results.
Great to see we're almost there. Okay, we kindly ask our partners from PANACEA not to vote so that we're not, you know, biasing the survey results in any way. But I think we're almost there. I think we can get up a little bit more. Or I think, well, now viewing questions, we're actually, I think, almost there, Christina, I would say.
Okay, so can I end the poll? And
yeah, I would say so. Yeah, thanks a lot, everybody.
Okay, thanks a lot for voting.
So what's the result of the poll then, Christina?
Sorry, I was waiting for you to be ready. Okay, I'm now sharing the results with you. So as you can see, we have 23% of you from hospital, clinic, and healthcare facility, and 23% from cybersecurity and privacy supplier companies. 46% of you come from research organizations, and one of you, which is 8%, from other types of organizations.
We have a limitation also in the number of options that we can give in these polls, but I think that's a pretty good result for our first poll. I suggest we go on to the next one. Yeah.
Okay.
Yeah, we can share these results with you afterwards, by the way. We can download the poll reports and create graphs out of them, or some kind of analysis.
Okay, so I'm going to launch the next poll. The question is, what is your role or field of expertise relevant for the workshop? I'm going to launch the poll now, and as before, we'll give you a few minutes to vote. Thank you.
Please note that the list is a bit longer than you immediately see. You can slide it up and down.
Yeah, good point, Pasquale. Thanks a lot for this.
Okay, so 12 people out of 14 voted. Maybe we can wait 1 more minute and then we'll close the poll and share the results. Okay, Steph, I think we can.
Yep, I agree. Yeah, thanks a lot, Christina.
So I'm now going to share the results with you of the second poll. Once again, the question was, what is your role or field of expertise relevant for the workshop? As you can see, we have a 17% of information security officer, 33% IT company, SME, and 50% researchers. Above all, in information system, bioengineering, and similar. Other options we had were technology manager, risk manager, data protection officer, or expert, IT company, but large enterprise, medical doctor or nurse, and hospital top manager or other, of course. Thank you all for voting. Steph, I'll leave the floor to you.
Yeah, I would say thanks a lot, Christina. I would say we can close this now and we can move on to the first session of the day with our partners presenting the Dynamic Risk Management Platform. So I'll just give the floor now to Pasquale, who will introduce the presenters. Let me just share with you the agenda again, Pasquale, with the names there.
Thanks, Stephanie. Okay, now we start with the presentations, and the first presentation is a presentation of the tool. It will be done by Fabrizio and by Silvia. And Fabrizio is an engineer and works with REA. REA is the company that develops the dynamic risk assessment platform and leads the team that does this development. Silvia is a professor at the University of Rome and has led the research behind this tool, and currently she coordinates the University of Rome contribution to the development of this platform. I leave you both the floor, Fabrizio, Silvia.
Thanks a lot, Pasquale.
Yeah, the floor is yours. Yeah, thanks a lot, Fabrizio.
I'm going to share the screen. Can you let me know if you can see?
Yeah, it's up. Yeah, you're ready to go. Thanks a lot.
Okay, perfect. Welcome again to everybody. We are going to make an introductory presentation to the tool, to Dynamic Risk Management Platform. And then we will have a demo with some slides also to go more in details and open, let's say, the interactive session. So we will start giving an idea of the solution toolkit that the PANACEA project aims to provide. Then we will focus, of course, on the DRMP, Dynamic Risk Management Platform tool. And we will explain which was the initial concept from the grant agreement, which are the innovation points compared to the market, what was done previously on the market, which is the current status, because we are in almost at the end of the development, but some additional work can be done. I think it is a good, let's say, moment to get some relevant feedback from you in order to refine better the coming development task. We will show quickly, high level, the use cases that we have to demonstrate before the end of the project. And then we'll give a really high, very, very high level idea of the design of the platform, mainly to let you know which kind of data the platform is managing. It needs to provide the expected capabilities for the end users, which is the logic behind, which is the computation steps that we implemented. Thanks to that, what we are able to show. We will introduce the concept emulation environment just to give an idea of how we are validating our platform against the expected organization networks that are within we are participating, collaborating in the project. First of all, the PANACEA. PANACEA I think everybody has a minimum of idea of what PANACEA project aims to deliver. But just to introduce you a bit more, we have several technological organizational tools that are part of the solution toolkit of PANACEA. And you can see that we are not only trying to deliver a specific solution for each need, but we are trying also to combine them in order to fit better the organizational needs. So each organization theoretically can select a subset of the tools in order to useful for them, basically. And the combination is not relevant only for let's say to cover the open needs for an organization, but also to bring added value, because some of these tools, despite if technological or not, there are some interaction between them that we are trying to exploit. Focusing the dynamic risk management platform, again, is a technological tool, of course, and is very relevant for the solution toolkit because it is able to interface also the organizational tools. We will come back to this point a bit later. What we can tell as a first statement that the DRMP aims to proactively protect complex IT infrastructure. I would like also to mention that this platform is developed by 3 partners that are collaborating in the work package 3 of the project. Are REA, as Pasquale introduced, University of Rome, Irina Consulting. You will listen all of us during this workshop. Which was the initial concept stated in the grant agreement? As I told you that the tool is expected to protect a complex IT infrastructure by quantitatively analyzing the current level of the risk, giving a multidimensional threat analysis, the current business impact. More details will be explained later. So if you have any question, just wait a bit for that. The risk and computation then trigger the definition of technical and non-technical mitigation actions. This, as well as innovative points, which is the objective is to reduce the risk level by taking into account the business impact that each actions may cause. I give the floor now to Silvia that will explain the innovation points that just to introduce to tell something more about that. We had a work package for research within the project. So some information were already decided, some innovation points were already identified before the project, but then we extended during the research work package the idea. Please, Silvia.
So thank you, Fabrizio. Here we try to summarize the main innovation points that we are trying to provide with this project. So the first one is on the modeling side. And in particular, we provided what we call a multi-layer attack graph model that basically will be the base for all our analysis, both for the risk and the response. Why this is innovative? Basically because if you look to the literature and the current tools that are available on the market, most of them analyze vulnerabilities of the system focusing on the infrastructure, so focusing on the technical part of the system. What we did here is try to model a larger view of the system, trying to capture not only the technical vulnerabilities that you have in the platform, so related to the hardware and the software, but also vulnerabilities affecting, for example, the human component of the system. So we try to model and represent human vulnerabilities. We try to represent vulnerabilities in the way in which people access the devices, so the relationship between the human and the devices, and also vulnerabilities leading to a huge impact on the business. So we considered altogether this aspect, and we formalized this model that it's quite new. I will go deeply into the details of the model later because, as I told you, this is the base of our platform. So I will explain in detail the layers and what they are going to represent. But in a nutshell here, we want just to tell you that the main outcome here is enlarging the perspective on the analysis. Can you go to the next, Fabrizio, please? The second innovation point, it's more technical in the sense that if we consider the response problem, so the problem of finding mitigation action to reduce the risk, the solution that are currently existing focuses mostly on technical responses. So basically, they focus on what you can practically do to remove vulnerabilities in the network. What we did was continuing to use this larger view, and we work not only with technical remediation, but also with non-technical remediation. So we are going to consider all that tools and instruments that we can use in order to remove or to mitigate vulnerabilities affecting the humans, or even vulnerabilities affecting the processes that we are going to take into account. Technically speaking, there is also a scientific novelty here because we try to formulate the problem formally as an optimization problem with multiple optimization parameters, while most of the time this problem in literature is taken as an heuristics. So we did something more formal. Next, thank you, Fabrizio. The last interesting contribution is the visual analytics environment that we are going to design. Basically because it's the tools that final users are going to use in order to interact with our system and support all the users with increased situational awareness. It means that in every interaction with the system, we try to provide to the security operator all the needed information that he needs to take decision in a natural way. So putting him in a comfortable position to take the decision. Here, the main innovation is the fact that he's going to use the models that we defined. So he provides this innovative interaction with the multi-layer attack graph and support the analyst in an interactive way. So it's not just a tool that takes data, makes some computation and provides you the outcome, but allows you also to interact with the system and to try what's going on. So you can play changing the parameters, run the computation and see the outcome. You can change another parameter and see the outcome, and so on and so forth.
Thanks a lot, Silvia. I think I can go on. So development status, just to give an idea, we are finalizing the version of each component because, as I was telling, it's developed by different partners, and then is foreseen until till the end of the year to integrate all of them. Actually, we are already doing that. So what we are showing during the demo is already integrated. Almost, it's just a few modules that are not yet integrated. So we are working, let's say, in advance regarding the integration and testing activities. So the planned use cases is foreseen, as I was telling, that to demonstrate the platform against at least in this case 2 use cases. The first one regards the Fondazione Policlinico Gemelli in Italy. That is a very large hospital located in Rome. And in particular, we are interested, of course, on the network of a particular process that is the communication between the laboratory information system and the medical devices at the point of care testing. So it's basically the process for perform a blood analysis when let's say the people go in front of the medical device to ask for this proper analysis, and then there is a communication between medical devices, some software deployed in the server farm. What is important for us is, of course, the process, but in particular how the platform is able to proactively propose a mitigation action to improve, to reduce the risk over the network. The second use case regards Ireland Irish Public Health Service Executive. So where the network is a bit different, why we selected this as well, because it's let's say concern also the wireless communication. In fact, is the real-time monitoring control system that is able to locate, of course, all the devices that the patient are using, the Holter monitor for Holter monitoring and so on. So this communication we are trying to replicate on the emulation environment that is currently ongoing. While, just I forgot before, this network is already in an emulation environment where our platform is already running, is already working fine. The platform, the design of the platform, very, very high level. We have a first block that is responsible for collecting, interfacing any external source. External source can be, I will go in details in the next slides, but can be external tools, the usual tools used in the IT environment, like vulnerability scanner or network management system. And the other type of sources are, let's say, for the moment, are provided through Excel form regards the business, all the data needed to create a multi-layer attack graph to perform a proper risk analysis. So this component interface these external internal data sources. When let's say it finds some changes, in particular over the network, then it generates a new snapshot. A snapshot, what means is just a unique snapshot of all the data set that we are able to collect. When there is a new snapshot, a notification is sent to the other component in a particular computational order, telling them which is the snapshot to take care to use during the computation, and the computation go on until we propose the response plan, so the set of mitigation action, taking and non-taking, to the end user through the visual analytics environment. Regarding the data sources, this is an important point for us because in some questions that we would like you answer later are related to this part, because we would like to understand which are the typical tools that are currently used in your hospital, your organization, so we can envisage to extend our capability in the data collection aggregation component. So far, we let's say we are able to download all the vulnerabilities from the NIST database. We use actually we are able to switch from in real time from a vulnerability scanner to another one. So far we are able to interface OpenVAS in Nessus, and then we have a set of let's say interface regarding to collect information about the network assets like WhatsApp Gold or simply SNMP or other NMAP. Something else? No, I think that's all. As I was telling, there are another set of data that are very relevant for us as a human policy, human vulnerability, employees, credential, all the information needed to build the business dependency graph that so far we just we are providing through Excel form, converting in common separated value that enable us to upload in our services. And of course, we have a predefined mitigation action group, let's call group, because then dynamically we are able to generate, to identify the specific solution for the vulnerability, the discovered vulnerabilities, humans and network. So something more regarding the next step. Once we collect the data are collected, a new snapshot is generated. The first step is, of course, the creation of the multi-layer attack graph. So all the information available are retrieved. The threat analysis component is responsible to create the graph and identify all the potential attack paths, also from a human layer. Then once this step is performed, risk evaluation starts, analyzing the business impact of each attack path. So let's say the likelihood that the impact are taken into account as usual in the risk evaluation. And later, of course, there is the generation, prioritization of the mitigation action, where we are potential evolution of our platform is also to, this is an example of interaction with the other organizational tools. We can include as a mitigation action, potential mitigation action, non-technical, also what is coming from the other organizational tools. Then, of course, also how we are going to show the information to the end user. It's a very important aspect that we would like to share with you today in order to see how we can improve, how we can simplify the visualization of this complex information, in particular the multi-layer attack graph. How the user, each of you prefer to use it, let's say. Emulation environment, this is just to give you a more clear idea of how we are testing, we are validating our platform. As an area, we have a cyber engine technology called CTEF. As I was telling you, you are able to emulate a complex network. In fact, what I'm going to show, it's a small network, but before the end of September, we will switch to validate our DRMP against a more complex network with around 200 network assets. Is hosted in Redo because we are based on Redo for what, at least for the business unit that provide the service cyber security services solution, where we have also the SOC service running. Regarding HSE, the second use cases, more probably the emulation environment will be built on their premises. So this as well is an option for the end user. So this is an example. I can just show quickly what I'm speaking about. So this is an example of a scenario that we can do. This we try to replicate partially the environment of Polyclinico Gemelli. So next step, just to give you an idea, is to go to reach this complexity, just a bit complexity of the network sites. Take a bit because so when you run this kind of exercise, you can design your network, decide which kind of validation exercise you want to perform. You can also simulate a cyber attack or whatever you want. We are using this platform also for training, for certification, research and development project, of course. I think that's all from me. Thank you for the attention. Don't hesitate to ask questions.
Yeah, thanks a lot, to both of you. I think we could probably move on to the demo session. Let me just share my screen so Pasquale can
Sorry,
see.
Stephanie, I think
okay.
there is a question. I don't know if you prefer that we
Okay.
answer.
Yeah, let's answer the question. Yeah, sorry, I hadn't noticed. I can't see the Q&A. Here we go. Yeah, we're just in the Q&A. Oh, yeah. Okay, so this is from Arnie. Thank you. Is the DRM tool supposed to ultimately aid real-time or near real-time automated decision support in relation to cyber risks? That's the first part of the question. Or is it supposed to provide a manual risk report for human cybersecurity function for periodic review? Do you want me to repeat the question, Fabrizio?
No, that's fine.
Okay,
I was
great.
thinking which is the best answer.
Okay.
Maybe Silvia can help me. What I understand from the first question, I think our platform is acting proactively. So we are just proposing the best mitigation action to solve the existing risk over the network. So we are not dealing with in the reactive way. This, let's say, we are not addressing this part. I hope that I answered correctly. Otherwise, you can come back again with the question.
If I can add something.
Yes, please.
So as Fabrizio said, this tool is not to be intended as a strictly real-time tool, in the sense that it's not taking into account stream of events happening at real time. But from another point of view, it provides feedback in real time, in the sense that, as I told you, you can interact with the system. So you can play a little bit with the parameters, and the system is going to answer and provide you the answer to the risk question that you are submitting. So in this sense, is providing feedback in real time and not just offline. Of course, it's not a fully automated system. So at the end, is the decision of the operator to decide what he wants to do or to review the suggestion that the system is going to provide. But it's not a completely offline tool that you launch, it runs, and then it provides you with a final answer and you cannot interact with it. So during the demonstration, we will show how you can play a little bit with it. So maybe if the answer is not completely clear, maybe at the end it will be. If not, please feel free to ask for clarification.
Yeah, I think
there is another question.
Yeah, I was telling that from Wissam. If you don't mind, Wissam, I think it will be very clear for you once the demo will be shown. If you don't mind to wait a bit more, then if it's not clear, neither at that moment we can answer.
Sure, yes.
Okay, because it will be very clear to see what how they are interconnected between them. Thanks a lot.
Yes, and as we now move on to the demo session, we ask our participants to also feel free to post in the Q&A panel any questions that they do have. If you need further clarifications or you have a specific question, you can use this panel as the place to do it, and we can then try and answer as many questions as we can online, live, so therefore live. If we have time constraints, we'll come back to you with more details after this webinar. Okay, thanks a lot. So the floor, let me just show you quickly this is for Pascal's benefit as well. Just quickly, just to see who is part of the demo, because we have a few more people in. Yeah, okay.
Yes, okay. Now we go on with the demo, and the demo will be presented by Silvia. Already presented her. She's a professor at University of Rome. Simone Lenti works with Silvia at University of Rome, and while Martina is from RINA. RINA is another one of the 3 companies developing the tool, and they are involved in developing part of it. RINA is a company, an engineering company, international, multinational engineering company dealing with certification, compliance, but also with security in general. So I leave the floor to the presenters.
Yep, thanks a lot, Pasquale. The floor is yours. guys. Thanks a lot.
Okay, so I'm going to share my screen. So I hope you can see the slides. Okay, in this first part of the demo session, I'm going to enter a little bit in the details of the multi-layer model that we presented as one of our innovation points. I will explain the rationale behind the model, and then I'm going to explain how we're going to use it in the system. And after this brief introduction, Simone will show you how you can interact practically with the system through the visual analytics environment. So, as Fabrizio explained, the two main functionalities that the dynamic risk management platform is going to provide you are support for the risk analysis and support for the response analysis. So the idea is that in the risk analysis, we will leverage on the multi-layer attack graph model in order to evaluate the two main components that contribute to the risk evaluation. So the likelihood of a possible incident and the consequences of impact. And in order to do that, we will use the multi-layer graph and the business dependency graph, one for the likelihood and the second part for the impacts. Given this composition of things, we are able to compute several types of risk. And once the risk has been evaluated, we will pass this information to the part of the system responsible for the response and the definition of the mitigation action that will again use the model in order to infer which are the best options for mitigate the risk and compute the best response plan to reduce the risk value. So what has been the rationale behind our choice of the model? The first one has been, let's try to think to the healthcare organization as a whole. So don't focus just on the infrastructure, because this is something that people are already doing since some time. But let's try to help the analyst with more information. So not just network, not just vulnerability, but with more information involving the network and the usage that people do with this network. So we started, of course, from modeling the infrastructural part, because we are dealing mainly with cyber risk, so it's central to our analysis. But we also decided to include in the modeling the people, because they are interacting with the environment, especially in the healthcare domain, where people that are interacting with the devices are not all technicians. There are doctors that need to interact with the environment. There are nurses, there are sometimes technicians in the labs. There are many different type of people interacting with the same devices and with a very different backgrounds in terms of security and technical skills. So they are prepared to be doctor, not to be security expert. And this is sometimes a vulnerability for the system from the cyber point of view. So we decided to put the people inside to help the analyst to understand how to support also the people in their work. People are, of course, organized in structure because they work together. They have hierarchical relationship given by the structure. So there is the main doctor, there are the residents, there are the nurses collaborating, and so on and so forth. And this is important because sometimes in order to work properly, you need to set up some procedures, and procedures are important in this context. And last but not least, there are the business processes that you need to provide, you need to support with the infrastructure and together with the people. So we put all together these elements and we try to highlight the fact that in every piece of the system, in every of these pieces, there could be vulnerabilities that exposes the system to threats and to possible incidents. So what we did is not focus just on the infrastructure, but start from the infrastructure and try to enlarge the view to include the people and the processes in a comprehensive view. So we modeled, as in the usual approach, the vulnerabilities of the network and the ICT infrastructure, but we also considered the vulnerabilities of the people, because they may have it, they are human, the vulnerabilities in the relationship or in the processes that people supports, and the vulnerabilities in the process themselves, so the business process itself. So if we start from these factors, from these variables, then it should be clear why we decided to use the term multi-layer, because for each of them, we identified a layer of our model. So basically, we placed all the pieces in a common picture, and we linked every layer with the others in order to have a complete understanding of the evolution of the system. So in the remaining of the presentation, I will go deeply into the details of what the bulbs and the edges means, in order to explain you which are the peculiarities of the approach and the flexibility also of the approach. So let's start from the network layer, that is maybe the most known part to security analysts. So basically in the network layer, when you are considering this type of things, you always talk about devices, intended as hardware and software, and their vulnerabilities. And we decided to keep this common notion that people use in practice. So we decided to represent the network as a graph, so a connected structure, where each node is a device, so it's a machine. And the edges represent the fact that there exists vulnerabilities on the machine that can be exploited by another machine. So if there is an attacker that in some way is able to interact with a machine, on that machine, it could do something that allows him to move on another machine exploiting vulnerabilities. So this is what we try to model. The fact that the attacker is not limited in a node, but it can move around. And this is the view that you will find in the system. So this part of the multigraph will be represented in a specific part of the visual analytics environment that you can query, you can interact with it, you can see different things that Simone is going to explain later. But as you can see, the visual representation is very similar to the intuitive one that we reported here in the picture. How can you use this layer? As I told you, the idea is that you have an attacker that in some way is able to control or to interact with one of your devices. And from these devices, thanks to the network connection, you can reach other devices. For example, if your attacker can control the device A, that could be a machine, a server, a medical devices, whatever, you see that on a connected machine, for example, B, you have two vulnerabilities that can be potentially exploited. And if we consider the details of the vulnerability, we see that from A, simply having a network connection, the attacker can exploit the vulnerability CV 2016-3169 and can get access to the machine B. So there is an attacker that initially has no access to B, so you think it's protected, it's safe, but at the end it has a vulnerability that can be exploited by a connected machine, and the attacker can reach B. Once he is on B, he can exploit a second vulnerability, and if we look to the details of the vulnerabilities and we look to the additional information at the bottom, we see that thanks to this exploit, the attacker can get administration access on B. It means that now the attacker is on B, something that is not supposed to access, and it has very high privileges and basically can do almost whatever he wants. So if B was his target, the attacker succeeded. If not, he can repeat the reasoning, looking for other machines that are reachable from B, trying to exploit other vulnerabilities and continue to move in the network. In this case, we have another node C, that has another vulnerabilities that again provide access to the user if exploited. So the attacker moved from A to C. And what we have here, as you can see at the bottom, there is a sequence of exploit on different machines that the attacker may use in order to move inside your network and to reach its target, okay? So this is something interesting because typically when you perform the common risk analysis and you do assessment using governance framework, you're not going to test all this kind of interconnection between machine in the network. So this tool can support and can be integrated from a certain point of view with the common risk analysis techniques that you're going to use. The second layer that we decided to model is called access layer. And basically the access layer represents the fact that in order to access a machine into your network, you need credential. And depending on the type of credential that you have, you access the machine with different roles and different privileges. So we try to represent all the alternatives that you may have in order to access the network. And so in our multi-layer graph, this simply means that for every type of authentication mean that you have to enter into your network, you will have a ball here inside the yellow layer and a connection to the device. This means that if your attacker is smart enough, he can try directly to corrupt your credential. For example, through a phishing campaign, he can get your credential and he can enter directly inside the network because it starts directly from the access layer. He don't need to interact with you. It simply theft your identity and enters into the system. So in this way, we can represent also this kind of situation. And again, here you see there is a path that from a particularly weak credential leads the attacker to the compromission of a certain target. Also in this case is the machine C. The third layer is the human layer. That is maybe the most interesting one here. That is aimed at representing what people does inside the company with the machine. So inside this layer, we have that the nodes, so the bullets, represent an individual. So a doctor or a nurse or a technician or an ICT employee. And the connection basically represents the possibility that people interact each other. And they may interact maybe because they are working together, or simply because they are working in the same physical location. And the interaction, as in the network layer, is the vehicle for possible exploit of human vulnerabilities. So we try to represent at the human layer the information exactly in the same way that we represent information at the bottom layer. In this way, we can use the same procedure, the same instruments for the analysis to work over the three layers in a consistent way. Also in this case, there will be a corresponding view in the visual analytics environment. This view is still work in progress. So here we have an highlight, but as you can see, it's very simple. It's not yet interactive. But at the end, we will have a similar environment to the network one, in which you can interact with the system. You can check who is working with a specific people, who is in the same physical location, and maybe you just need to reallocate people in different rooms, who has many dependencies in terms of relationship, and maybe you can decide to weaken its load and take another person to help him, and so on and so forth. So even in this case, interacting with the diagram, you can infer a lot of interesting information. As I told you, the effort that we did here was to try to model the layer in a consistent way so that we can reason consistently over the system. And in order to do that, we needed to model what a human vulnerability is. So we started from standards, and in particular, we started from ISO 27005, where in the appendix there are listed many vulnerabilities. So we extracted those that can be associated to a human. For example, here we reported a list of some of them. And we identified what we call a cybersecurity profile that are somehow characteristic of the individual that allow us to link the vulnerability to the people. So in this way, we are able to associate a human vulnerability to a specific person. As you can see, most of the vulnerabilities are related to common practice sometimes. So I'm not logging out the workstation, I'm sharing my credential with other people because otherwise we cannot work efficiently. I have a poor password management, so I use default password, or simply I leave the password written down on a post-it, and so on and so forth. In this way, we can use the same mechanism that I described at the network layer in order to chain exploit at the human layer, and to start, for example, from someone that is sharing his password, and to get credential of someone that I am not supposed to interact with. So in this case, suppose we have these three people. D has the vulnerability of sharing credential that as consequence the fact that this credential can be accessed by A. D can influence, maybe because it's the responsible of someone else, the behavior of another person, that maybe can force him to leave the workstation logged in, and so on and so forth. And so we can chain all these vulnerabilities, and we can link the human layer to the network layer. And we are able to analyze these paths flowing from the human to the network. Again, we can chain human to the access, because human have accesses to enter into the system, and we link the three layers, building up paths that starts from the human and as target a machine in the network. Here you have the view inside the system of the result of the traversal of the graph. So each time that we are trying to infer one of these chain of exploit, we are building up what we call path, and the union of all the paths that we are able to compute produce what we call a multi-layer attack graph. In the visual analytics environment, it will be represented in this way. And Simone will go deeply into the details later in the demonstration. As I told you, another important point here is the business component. So we decided to model also the business aspect. And from the business point of view, we try to represent the business processes, the service that are needed in order to provide the business process, and the asset that host the services that we need. So inside the business layer, we have a kind of tree structure that links the main concept of business process to the device that at the end support the provisioning of the business process. I'm going quickly into the formalization of this structure because it's fundamental to understand the way in which we compute the risk. So I told you that this business representation is provided in a form of a tree. So it means that you start from the business process, you have several bullets that represent the services needed to support the process, and so on and so forth. A bullet is basically expressing the security characteristics that you want to be satisfied in order to support the process. And in particular, for each business process, we characterize it in terms of the service levels that are acceptable for the provisioning of the service. Why we are going to do that? Because maybe for you it's acceptable that there is a business process that preserves, for example, the maximum of the integrity and the maximum of the confidentiality, but you don't care too much about the level of availability. So it is acceptable for you to have full availability or to have partial availability, so availability degraded. In this case, you don't have just one item for the business process, but you have two, because for you it's acceptable that it works in two different service levels. And the graph then at this point is obtained simply connecting the service level. So the service level for the business process with the service level of the service with the service level of the assets that you need. We also modeled the fact that there are dependencies that may require that you have alternatives. So in order to support one business process, you can choose one service or its replica. So we modeled this as an any relationship. So you don't care which of the two, the important is that at least one of the two is available. And the other relationship is the all. So in this case, you don't have an option, you need all the components to work in order to support. So here in these slides, we have an example in which you have one business process that for you is acceptable with two different service levels. One service level is supported by an alternative between A1 and A2. The other one needs A2 and A3. So you can construct different relationships to support the definition of your business. Inside the system, this is represented in a view, the business impact analysis view. This is how it looks like. And also in this case, you can interact with the view in order to explore how the business process is structured, which are the dependencies, which are the assets impacted by the business process. You can select the assets and understanding all the business processes that can be impacted if the asset is not working, and so on and so forth. So you can interact with it and understand the complexity of your environment. So once the model is constructed, it will be stored inside the system, and then we can play with it interactively, as I told you. So you can ask specific risk queries, and the system will compute and provide an answer. How this is done? So basically, depending on the type of query that you are performing, we need to query the multi-layer graph and the business dependency graph in different way. But conceptually, what happens is that you go over the layers of the multi-layer graph, you find the chains that contribute to the events that you want to assess, and compute the likelihood. So once you have the paths, you link the paths to the business dependency graph. So you link the assets that you have impacted in the network layer with the assets that you represent in the dependency graph. And you interact with the dependency graph in order to understand which are the linked assets. So basically we have, from one side, you may start from the human going down to the machine. Then when you reach the machine, you can link it to the business and understand which are all the business processes impacted by the exploit of a vulnerability on a human. Here I represented one path that leads to hitting basically two different business process J, and one of the acceptable level for business process I, and another path that is linked to the business process I. So depending on the type of risk that you want to assess, you may consider both of them, just one of them, or a combination of them. When you go inside the system, this is what you get. So you have the combination of all the views in which you can explore the paths that you obtain in the multi-layer graph. And this is what you can see at the right of the screen. In the center, you see the dependency graph, and so the link that you have between the assets and the business dependency graph. And on the left, you have the resulting risk value. So Simone will show you in a while how does it work in practice. Which are currently the risk query that we are able to compute. So basically we are able to ask to the system the risk related to full compromising of a business process. So we select the business process, all the service level of the business process, and we ask for the related risk. We can ask for the risk related to a specific service level for a given business process, so not all, but just one. Or we can ask for the risk related of the compromising of an asset. So we select something at the network layer and we ask which is the impact over business processes and the related risk. For this first part, that's all. I'm going to check the question before giving the floor to Simone. Okay, privacy concern. We thought about it. Of course, when you interact with human, there are always privacy concerns. The type of information that we are going to use here are information in some sense. There are some personal information because, of course, we need to identify in some way the person. But this is not relevant for the system. I mean, you can first take, for example, the organizational chart, anonymize the organizational chart, and then you can reason over anonymized data. This is not, the system does not care if the doctor is Mario Rossi or is Giuseppe Bianchi. The system just cares about the fact that there exist individuals and that there exists a relationship. So we can play a little bit with the anonymization. So the techniques in this sense that does not care about the personal information. For the other things, what the other type of information that we are collecting, just consider the roles. So if you are a doctor or if you are a nurse or if you are a technician. So also in this case, we don't care about your name. We just care about the position that you are taking in the organizational chart. And to analyze the vulnerability, of course, also in this case, we need at sometimes to link your cybersecurity profile with you. But also in this case, the type of question that we are trying to use in order to assess your vulnerabilities are not entering into the personal data. So we are taking particular care of this. We will have a validation of the approach. So we will see if this degree of anonymization that we are using it's enough, or if we need to think something more because maybe we need more personal information and then we need to think something different. For the moment, I can say that it should work.
Okay, thanks a lot, Sylvia. I think we can move on then now to Simone's presentation or part of the demo. Thanks a lot.
Yes, hello everyone. Do you hear me?
Yes, this is a baritonal voice. Yes, it's yours.
Okay. Sylvia, okay.
Okay.
Okay, now I can share. Okay, do you see the screen?
Yes.
Okay, perfect. So hi everyone, I'm Simone Renti from Sapienza University of Rome. And I will present you the tool that we are developed. And in particular, I will focus on 4 of the main functionalities provided by the tool. So we will start with the topology view. As Sylvia previously said, here the idea is to provide to the user an instrument to analyze their interconnections, mainly between the devices, but also between the devices and the users, and to understand what are the reachability conditions between the services provided by these devices. So we can start the video, and it's not surprising that the first step is to log in into the system. We log in, and here in the home page, we can see the list of available snapshots, and we select the last available snapshot of our system. Okay, we load it. And when a snapshot is loaded, here the user has a default risk analysis. I will give you more details on this later. Then you will be able to understand what is represented here. But for now, we start our demonstration from the topology view. So we select it from the menu. And here we have the representation of our infrastructure, basically. Here we have all the devices of our network. So all the nodes of this graph are devices of the network interconnected at layer 3, so by their IP. And here you can see that you have the representation also of the subnetworks and of different types of devices. So for example, this is the firewall or network. These are network devices. This is a switch. Here in the server farm, we have a server, and we represent also the medical devices. In particular, we have two medical devices, these two, POC1 and POC2. Okay, so this is a quite standard representation of the network. It is the classical node link diagram representation of a layer 3 network. Inspecting a node, we can have some information about the device. So for example, here we have the list of all the local services provided by this device. There are 17. The information about the network interfaces of the device. So this one has just one network interface. We has its IP, the subnets, this kind of information. And also the list of network services. So this device provides 3 network services that are listed here. Okay, and what we can do in this network? We can, in this view, sorry, we can select a device, and here we can see some changes in the encoding. So the selected device now is highlighted in blue, and we can see the blue edge that represent its connection with its subnet. And then we can see that we have red devices and green devices. And what does it mean? If we highlight one of these devices, for example, this red one, we can see that now here we have a list of provided services. What does it mean? This node is red because it provides network services to the selected node. Basically, it means that PC1 provides the CEFS and MSRDP to the POC2 device that we selected. Okay, and for the green nodes is basically the contrary. We highlight one of these, and we can see that now that this device instead can reach a service provided by the selected node, www in particular. In this way, we can have a quick understanding of the reachability configuration of our network, and we can understand if it is right that this node provide the www services to the list of the consumers, and if it is right, that he can reach the services provided by the producers visible in red. In particular, here we can see that this device has 3 network services, these 3, but just www is provided to other devices in this configuration. Okay, we can change a bit the encoding of the network. In particular, we can move from a star representation of the subnetworks to a mesh representation. It can be useful for more advanced analysis. Here you can see that now we have highlighted in blue all the devices connected to this one, so all the devices in the same subnetwork instead of the connection with the subnetwork. But for a default usage, we can use the default configuration of 2 to 3. Another thing that we can do is to add the humans. Okay, now you can see that we have more nodes. We have the representation that the network that we have before, but we have some other nodes, the squares in particular, that represent humans. And they are connected to the devices. You can see, maybe I can highlight here the connection between the humans and the devices. And a connection means that the human has credentials to access the device. Highlighting a human, we have brief information about the human selected. And now we can see that there are some changes when we select a device. We select now the same device that we have selected before. Now we can see that we have 6 blue edges because we represent, we highlight all the, we want to highlight all the humans that have credentials to access these devices. So basically, they are all the nodes targeted by these blue edges. But we can see that there are also humans highlighted in green, in particular, these 2 on the top left. What does it mean? It is something similar to the thing that we saw before. It represents the fact that this human, Giovanni Del Neri, that is a technician of the laboratory, has no credential on the POC2, but he can reach a service provided by POC2. Again, the www service. The idea is that this human has the credential to access this machine that can reach the service provided by the human. In the same way, we can select a human, and again, we highlight all the devices for which this human has credential. There are these 4. And in red, we highlight all the devices that provide a service that can be reached by the selected human. So for example, these 2. Okay, these basically are all the functionalities provided by the topology view. Before pass to the data graph view, if you have a question on this part, maybe it is the right time. Otherwise, I can go to the next part.
No questions for now, Simone. I suggest you move forward and we'll collect any Q&As afterwards. Thanks a lot.
Okay, perfect. Thank you, Stephanie. So we move now on the data graph view. And here the idea is to provide a tool to inspect the vulnerabilities of our environment and all the possible exploits between the entities of our environment as Silvia previously presented. So we can start. Okay, we are moving from the topology view. And we move to the attack graph view. Okay, you can see that it is similar, at least at the first sight, to the topology view. We have the same representation. Here we have the human already represented. But you can see that the nodes are colored with this pink scale. Basically, white nodes are nodes that have not vulnerabilities, while colored nodes are nodes with at least one vulnerability, and the saturation of the color is proportional to the number of vulnerabilities. Here we can highlight this device, and we can in fact see that this device has two vulnerabilities. In particular, they are network vulnerabilities. We have the information, we have the CV identifier of the vulnerability, and the precondition required for an attacker to exploit this vulnerability, and the post condition that can be reached by an attacker if he is able to exploit the vulnerability. Highlighting on a vulnerability, clicking on it, we can have more information. For example, for this vulnerability that is a new one, we have the CVSS version 3 information about it. And for this that is very old, we have just the CVSS version 2 scores. And we can see that we have the vulnerabilities on devices. We have also a lot of vulnerabilities on our medical devices. And we will see what is the impact of this later. But we can see also that we have vulnerabilities on the humans. In particular, this one, that is the department director, has two vulnerabilities. That is sharing credential, which is a vulnerability. We can move on, and I think, yes. It means that this person has the attitude to share her personal credential with others. Again, we have the precondition. So basically, he tends to share the credential with co-workers. And the post-condition is that someone that exploits this vulnerability, after the exploit of this vulnerability, own the credential of the doctor, basically. We have also information on the complexity of the attack and of the identity impact of this vulnerability. Another vulnerability is no logout for this human, and we can see that we have at least 4 humans with some vulnerabilities. So here, for example, we have a poor password management. So this user tends to use weak passwords. Okay, so now we can see what we can do interacting with this view. We remove just the human layer to start simpler. We select a device, and here we have the representation of all the exploits that are targeted to this device or that can start from this device. In particular, in green, we highlight the device that can reach the selected one, and so that can be used to exploit a vulnerability, or at least one vulnerability, of the selected node. So from all these green devices, it is possible to exploit a vulnerability on the selected node. So if an attacker has the right to access to one of the green node, he can exploit a vulnerability on the selected node, so he can or have write permission on that device, or have an impact on the functionalities of the selected device. And in green, we highlight the devices that can be targeted by an exploit starting from the selected node. So here, this workstation has again quite a high number of vulnerabilities, and at least one of these vulnerabilities can be exploited by the selected device. We can have also both this condition for the same device. So for example, for this mail server, it is colored in yellow because from this device, it's possible to exploit vulnerabilities on the selected node, and on the contrary, from the selected node, it is possible to exploit these vulnerabilities on this yellow node. Okay, and we can select other devices. So for example, we select this PC2, and we can quickly see that it can be just a target of an exploit, but from this device, an attacker cannot exploit vulnerabilities on any other device because we don't have red edges and nodes. Okay, now we add human, if I'm not wrong. Yes. We add the human layer. And we repeat the same selection. Okay, now we have the representation of the devices that can be the source of target of an exploit as before. And down in this light blue, we we highlight all the humans that have credentials to this device. And why it is important? Because we know that humans can still be vulnerable. For example, we saw that the department director has vulnerabilities. We select it, and in fact, we see that he can be targeted by an exploit. In particularly, he can be targeted by exploits from two colleagues, from these two, Giorgia Neri and Francesco Vanni. But it can be targeted also by an internal attacker. Here we have this new human that is not an employee, but represent a possible internal attacker. Okay, and we can see that we have this green edge between the internal attacker and the department director. So it means that an internal attacker can exploit these vulnerabilities on the human, and using these vulnerabilities, he can access the devices for which the user has credentials. So basically the two PCs and the two POCs. Again, here we have a yellow human. It means that he can be both target of an exploit or source of an exploit in relation with the selected node. Okay, we can also change the encoding, the basic encoding of the edge, and we can have this representation. This is a compact representation of all the possible exploits between the entities of our environment. And you can see that there are edges that are colored from green to red. They are directed. Again, they represent exploits, so from the source in green to the target in red. And we have in light blue the credential relation between human and devices. It was just to provide an intuition. We can interact with the system, and we can, for example, start our analysis from the internal attacker. We can see what are the humans that can be targeted by an internal attacker, and then we continue our analysis. We select one, and we can see what can be the next step. But you can see also that this encoding somehow give you an hint of possible exploits between entities, at least in the sense that we can see that there are edges with just nodes with just green edges, so this one, for example. And basically it means that it can be just be a source of an exploit, but it can be a target. Or we have node with just incoming edges red, so it can be just a target of an exploit, or both of them. Okay, this is the end of the part about the ATA graph, and it is functional to our risk analysis. So again, if you have question, I don't know why I cannot see anymore my Zoom. Maybe here. Yes. If you have question, maybe on this part, on the encoding or on the functionalities, maybe it is the right moment. Otherwise, I go on and I will present you the other part.
Yeah, I suggest we move on, Simone, and then we take any comments and questions in the interactive part, which we're coming up to quite soon. Thanks a lot.
Yeah, so we can back. Yeah, sure.
Yes.
Okay, so the last two main functionalities. Now we move on to the dependency graph view. As Silvia said here, this is the data graph. So we move on to dependency graph view. Okay, here we have a representation of the business model of our organization. So we represent the business entities with these rectangles. So rectangles represent the business entities. And in particular, we have three types of business entities. We have the business processes that are recognizable by the cross icon on the service levels. So this one. We have the services that supports the business processes. So for example, this support and so on. And we have the assets. Basically the assets, we will see it later more in details, are mapped to the devices of our network. So are the devices that need to work to support the functionalities of our organization. So we have the representation of the business entity, and with this circle, we represent the service levels of the business entity. We can see that all the entities in this model have just one service level, except for the urgent analysis business process that has two service levels. The color are not perfect, but I think that you can see that the color of the nodes is not equal. It is different, and it is proportional to the impact on the business continuity of the specific entity. In particular, we can see that urgent analysis has two service levels. This one with confidentiality, integrity, availability guaranteed, intact and nominal, with an impact of 0.6. So it means, what it means, an impact of 0.6, that if this service level is impaired, we have an impact of on our urgent analysis functionality of 0.6. So it is quite high because the impact is from 0 to 1. And here we have another service level, but we have degraded availability with impact 1. It means that if this service level is not guaranteed, basically all the business that we have to provide is compromised. Okay, this is the reason for which it is higher. Okay, so here we represent business entity service level and the dependencies between these entities. As Sylvia said, we can have direct dependency. So for example, this service level depends on just one service level on another business process, just on test archiving. But now this service level, the service level of test archiving, sorry, depends on 3 different services, these 3. And we have this triangle here. It means that it is a null dependency. So basically that all these 3 services have to be guaranteed to provide the right functionalities to the test archiving business process. Here, this service, Alia Client, depends on 2 assets. In particular, you can recognize that there are the 2 POCT that we saw before in the network view, in the topology view, and in the data graph view. But here we have this triangle upside down. It means that it is an any dependency. So to support this service, at least one of these 2 service levels has to be guaranteed. Okay, I hope it is clear the difference between the 2 kinds of dependencies. Okay, here we can, again, inspect service level lead impact. We can select one of them to quickly see its dependency tree. So here we have selected that service level of urgent analysis, and we can see highlighted in red its dependency tree down to the asset. So we can quickly see that it was just another business process, and there an any dependency between these 2 assets. But here, maybe we can show it here. But this functionality can be useful when we have more complex dependency, like the dependency tree of these service levels. And again, here we have a quick representation of all its dependencies down to the asset. We can quickly see that there are also other business processes. For example, the test validation business process, the remote reporting. And we can also select something on the bottom of our dependency graph, so some asset. And we can see from this asset highlighted in blue what are all the services and business processes that can be impacted if this service level is compromised. And we can do for all of them. In the same way, we can select something in between, so something that depends on something else, but it is also a dependency of some of others. For example, the report lookup business process, then it is a dependency for the remote reporting business process, and that has the dependency tree highlighted in red. Okay, these are the functionalities of this view. And now we will see how we use it for the risk analysis. In particular, the risk analysis view is divided in 2 phases. Now we will see how to make a query, so how to ask for a new risk analysis. And then we will see how to inspect the results computed by the DRMP backend to respond to this query. So for now, we start making a new query to the risk analysis engine. So this is the graph. And we move to the risk analysis. Okay, here we have the composition of 2 views that we have already seen, the dependency graph view and the data graph view. But here we use them in another way. Let's start our analysis from the dependency graph view. you can see that is the same representation that we have before. And again, we can select a service level, see its dependencies, and so forth and so on. What we can do now is to add a service level as target of our query. We just added test execution as target of our query. What does it mean? It means that we are interested in all the possible paths, so in all the vulnerabilities, in all the stuff that can go wrong, that can impact test execution. We want to focus to this business process. Okay, so in particular on the service level of this business process. It has a default impact of 1. We can change it. Here we have the representation of its dependencies because we just added as a target. And we can also add other targets. So for example, now we want to focus our analysis on test execution and test validation. We have the representation. Test validation has a default impact of 0.8, but we want to change it. For this query, we consider that it has an impact of 0.6. We can remove it if something goes wrong, but we are happy with this. Okay. And so now we have just selected 2 targets of our queries, and we can see all the dependencies of these 2 targets. Now we'll see how this information is propagated to the data graph view. If we move down, okay, we can see that we have some devices that are highlighted in red. It means that these devices are the implicit targets of our query. Why? Because they are in the dependency trees of our targets, of the targets that are business process. I'll repeat myself just to be clear. But if some of these devices, so the devices highlighted in red, is impacted by some paths, the business processes that are the targets of our query can be impacted. In particular, we can see that we have 6 of them, and that these 3 are not targeted by any network devices, but that there are network exploits, sorry, but these 3 devices can be target of network exploits. So how we can use this information? We remove the data graph edges representation just to clean the view. And again, we can use the functionality that we saw before, so the selection of the device, to see, for example, that this device can be reached by 6 humans because they need to access to this device because they have a credential, but it can be also targeted by 6 devices. So starting from these 6 devices, it is possible to exploit a vulnerability on this one. And we can see that there are devices also in other networks. So for example, from the administrative LAN. And we can see that also this device can be target of an exploit, again from this source. So we decided to add this device of the administrative LAN, this internal server, as a possible source of an exploit. It means that now we are assuming that somehow an attacker can reach the internal server. So for example, by physically accessing to it, right? We can refine the initial permissions that has our attacker. It can be non-user or root, but for now, we use the default configuration. But if we come back, we see that, again, we have human that can access our inferred targets. So, and some of them can be targeted by an internal attacker. So we add the internal attacker again as a possible source. And here we can refine the probability of a resource. In particular, for the internal attacker, we set a probability of 1. Okay, now our query is ready. We have set the sources, we have set the targets. We just give a name to our query to retrieve it easily later. So test execution and validation, because they are the targets. And we send it to the backend engine. Okay, now we will see how we inspect the results of our query. The backend, the risk analysis engine respond to our query. So now we can expect the test execution and validation query. You can see here that we are inspecting it. Okay, and here we have this representation on the data graph. Now we start the analysis of the results from the data graph, and then we will go to the dependency graph. So the contrary with respect to the query. Okay, and we see that the nodes of our data graph view now have different sizes, both the nodes and the edges. So because the size of the entities now is proportional to the number of paths that involve the entity, we can see that there are 43 paths that start from an internal attacker and that can impact, again, the target of our query. So they can impact the business processes. Okay, we recognize it that is a source because it is green, it is very high, and we have also path from the other source, from the internal server, is smaller. In fact, we have just 10 paths. And we can see that we have blue nodes that are intermediate step of our paths. What does it mean? Here we have 18 paths that involve Mario Rossi. It means that the internal attacker exploits the vulnerabilities of Mario Rossi, and then Mario Rossi is not obviously the target of our query, but he used this step to make other step and reach the target. Okay, so all these humans can be targeted by an exploit of an internal attacker and can be used to reach the final target. In particular, we can see that here, for example, we have also edges between these two humans. It means that the internal attacker can exploit a vulnerability of one of these two, and then can use his credential to impersonate this one and stole also the credential of this other human. So we can have also quite complex situation. In red, we have the targets of our paths. We can see that we have 23 paths targeted to the POC1. And we can see this pie chart of POC2. Why? Because it can be both an intermediate, it is both an intermediate node for some paths. So it is used as a step to reach another target. So to reach basically the POC1 or this other device, or it can be the final target of the path. And so we have this pie chart representation with the areas proportional to the role played in every path. And we see how this information now is propagated to the dependency graph view. For now, here we just represent the worst case, basically. So we consider the path with the highest likelihood, and we use it to compute the risk. So we use basically the likelihood of the path It depends on the number of steps, on the conditions of the vulnerability, on the characteristic on the vulnerabilities, on the cybersecurity profiles, on the humans, and on all this stuff. And we use this information to compute the risk. So remember that we selected 2 business processes as targets, test execution and test validation. Here we can see that test execution can be impacted in red from the POC2. So it means that the path with the highest probability targets POC2, while test validation has this yellow color. So we expect that the risk is lower, and we will see it, it is right. So from a path targeting this device. Here on the right, we have a drill down on the risk. In particular, we compute the risk for 3 different attackers. Basically, we consider that we can have a naive attacker, an advanced attacker, or a professional attacker. And they have increasing skills, basically. And we can see that a naive attacker cannot impact none of these 2 business processes, starting from the sources that we set, because the risk is 0 for both of them. While an advanced attacker, an attack from an advanced attacker, has a risk of 2.71 on test execution and a 1.63 on the test validation. Okay, this is an idea how to inspect a query. We can remove it if we don't like it. We can make a new one. Or we can also select, we can inspect all the queries previously computed. For example, this query that has remote reporting as target with an impact of 0.1, starting again from an internal attacker and from another device. Or we can see also the query that has both the service levels of urgent analysis as targets with different impacts, with their default impacts. So this has an impact higher with respect to this one. And we can see that, again, the risk is computed so with considering the impact of the processes. And we can understand it here because both of these service levels can be compromised by a path targeting POC2. But we can see that the dependency chain is colored with different colors. One is red, one is yellow, and the corresponding risk is more than 2 and 1.6, because the impact that we assigned to them is different. Okay, I think that this concludes the presentation of the main functionalities of the environment. And now, again, we can have questions, or I can leave the floor to Martina that will present to you the work that we are making on the response.
I think it's a good idea to move on to Martina, and then we'll do the Q&A.
Yeah,
on the whole thing. Thanks a lot. Thanks, Martina.
Okay, so step sure.
Yes, okay.
Martina, sorry, Pasquale speaking. Control your time, because we would like to have also feedback on what we are doing. So take control of your time. Thank you.
Okay, okay, perfect. So I'm going to share my screen. Okay. Good afternoon. I am Martina Bossini Baroggi, and I will talk about the resilient response engine The main objective of the resilient response is to propose a list of actions to mitigate risk. This list of actions derive from a pre-configured list of approved technical and non-technical mitigation actions. For example, a technical mitigation action could be the installation of an antivirus on a specific machine, and a non-technical mitigation action could be a training session for people involved in the healthcare organization as a doctor or nurses. The core of the resilient response is an algorithm that implements an optimization problem that has as objective the function of minimizing the risk of the attack path by selecting the best mitigation actions, taking into account that we want lowest overall cost. As explained by Silvia before, all the information related to the 4 layer are an input for the resilient response. So we consider both human and human access, network and business layer. An attack can start from the human layer and go through the access layer to reach the network layer. As we can see here, we have an example of an attack path explained before also by Silvia. The objective of the response is to minimize the impact of this attack on the business layer and to minimize the risk of this attack path. So we would like to block the attacker that would reach his target. As we can see in this slide, we have several ways to block this attack. In fact, we can provide different combinations of mitigation action, but we would like to understand what is the best combination of mitigation actions. The objective is also to preserve the business layer. In order to maximize the risk reduction, so to minimize the risk, we should cut all the highly risky paths using the minimum number of mitigation actions and using mitigation actions that provide a quick benefit. And as said before, we would like to impact the business as less as possible. We considered some issues inside the algorithm that are that some vulnerabilities could not have a patch, or if they have it, this patch cannot be applied. Finally, another issue is that some mitigation actions are too expensive. The resilient response get as input all the information from human access and network layer attack graph. As we said before, the attack graph is composed by nodes and edges that connect the nodes. And for each node, we have one or more vulnerabilities. All the vulnerabilities are collected in a vulnerability catalog that contains both network and human vulnerabilities. Moreover, the resilient has as input a pre-configured list of mitigation action, as said before, both technical and non-technical. For each mitigation action, each mitigation action is related to one or more vulnerabilities. And other important inputs are the list of starting nodes, so the list of the sources, and the list of the target nodes, because the resilient response needs to understand where the attack path starts and where the attack path ends. Finally, we need also information about budget for mitigation actions. This, in fact, the healthcare organization that would use this system needs to provide us information about the maximum budget that you would like to use for mitigation actions that should be applied. Here we have the output. The output of the resilient response will be shown in the visual analytics environment. We need to implement also a view for this part. The output consists of a list of mitigation actions to be adopted. As said before, there are several combinations of mitigation actions. We will provide as a first choice the best combination, taking into account the budget. From the second choice, the combinations will be ordered according to the risk reduction. Moreover, for each mitigation, we will provide the effectiveness value and also the nodes of the path in the attack graph on which the mitigation will be applied. Okay, from my side, that's all. So we can proceed to the Q&A.
Yeah, I would. Yeah, thanks
Thank
a lot,
you.
everybody, for the presentations and the data showing us how the tool actually works. I think we can move on now, Pasquale, to the final session, which is, let me just show you a second, the this one here. So here we have a brief introduction of the panelists on our side. If you'd like to just do that, Pasquale, and I suggest we move straight into the interactive Q&A and then the feedback with the polls. Okay.
Yes, thank you, Stephanie. Okay, now we hope to have shown you what the solution is about, how it works. So you can ask further questions, other questions in addition to the ones that you have asked until now, with the purpose to understand. To answer the questions, all the people that have spoken until now is available. Also, you see here other names. You see Silvio, even Giuseppe Santucci, Alessia Palleschi, and they have been involved in developing the solution. So they are the best people to answer your questions. So I would ask the participants to ask questions, to write them on the Q&A panel. So please write it, and then we'll go through them. So let's take some minutes for you to do this. Okay, my understanding is that maybe there is no need for clarifications because I do not see questions, at least in there is one. Let's see. From Hani. And okay. Okay, the first question is, has the tool been tested with business stakeholders? I sense it may be too complicated for business decision makers. Okay, let me give my answer at the moment. Hani, this is the first time that we show what we have seen to the business stakeholder. So obviously we have tested them, we have developed them involving the stakeholder and the end user that are working in the project. So this means Gemelli Hospital in particular. And for instance, the visual analytics part has been checked with our people from the IT department. And they found it interesting and they contributed it. But however, what you say, too complicated, this is already some feedback from you. So the answer on my side is that we have not yet tested. This is the first time we do it, and this is the main purpose we do it, to understand what is the reaction. I don't know whether Fabrizio or Silvia, you want to answer to this, provide another answer to this question from Hani.
Oh, that's true. What you told, for me, it's fine. Please,
Okay.
Silvia, I think.
No, just a small comment. Your feedback are more than welcome, even because we have a few months for refining all the components. So every feedback like this one, it's very appreciated because we can work a little bit on it. So we can improve the presentation of the dependencies. We may improve the way in which we convey the information. And I think that this system is complicated, you're right. It's very complicated, but at the end it will be used from security experts, so they will be trained against it. So on one side, the answer is yes, you're right, we have to simplify some things, and any comment and suggestion is more than welcome, because of course you are the users, and we appreciate every feedback that you can provide. On the other side, the system is complicated, and of course it cannot be used without a proper training. But I think this is a common point for every tool that is used by cybersecurity experts.
Okay, let's move to the next question. This is from Ercud and Rios. Could you repeat the difference between business process and business process level? Your model, this is the first question.
Sure.
In addition, in your model, the business process has several business activities.
Yes, so the business process is the general process that you see in the list of activities. For example, here, the business process is urgent analysis. So it's the main task. Then the process urgent analysis can be available depending on different level of, for example, availability or confidentiality or integrity of the service. So when you say that urgent analysis has 2 service level, it means that for the organization it is acceptable to have it with full availability or to have it with degraded availability. So in that case, you have one business process instantiated with the 2 different service level. If in your system you don't have this distinction, so your business process can be is acceptable only with a certain quality of service, then in that case there is no difference because the mapping is one-to-one. But if you may provide the service with different quality of service, then we can capture this with the model.
Okay, then there is the second
part
question is about the granularity of description, I understand, of the business process.
Yes, you can go in the very fine granular details because the concept of services that we have somehow as an intermediate concept between the process and the asset can capture the service that you have in the machine, for example, the service that you're offering online that could be an FTP server or something like that. It could be an application service. It could be a service in the sense of web service. So the notion of service capture very different things. And also in this case, they are characterized by the service levels. So also in this case, if you have different quality of services that are acceptable to you, you can represent them in the model. Otherwise, you have just one element for each entity that you want to describe. So the model is flexible. Then it's up to the user of the system to understand the granularity that he wants to put inside the model. He can simply use one concept in each set, or it can go deeply and model also the relationship between different service level of each component. I hope this answer. If not, please let me know. I will try to explain better.
Thank you, Raz.
Okay. Then Silvia, there is Silvia and also Fabrizio. You see, there is another question from Wissam Aluli. And maybe if you read it and if you answer directly to the three questions. That,
yes, I can answer the first one, then leave the floor to Silvia for the other two, I think. Yeah. For the first vulnerability database that you use in this tool for different layers, as a vulnerability, we are managing human and network vulnerabilities. The network vulnerabilities are dynamic ones, so what the vulnerability scanner are detecting. The humans, we are currently supporting a subset of the identified human vulnerabilities in the project. So has been performed a dedicated research activity to identify human vulnerabilities. So we have this catalog that we have built, where we can add, of course, any other vulnerability that further we would like to add. It's not impacting the, let's say, the platform development. Is something.
Is it an open source catalog, or it's something internal?
I think it's internal, but Silvia, maybe please.
You mean the human vulnerability catalog? So the human vulnerability catalog basically is one of the outcome of the research task that we did. So it's reported in one of our deliverables that is public. So I think it's public. I can say that it's public.
Okay. So,
this
so
is
it will be available on the website of the project. Okay.
Yeah, it should be.
It should. I'm not so sure, Silvia.
Yeah.
It should. I don't know.
Let's check. But no. However, it is internal, meaning that has been developed in the project. You have to consider that in this project there is also the Northumbria University, is a UK university, and the psychology department is a partner in the project, and they take care of the behavioral aspects in the human layer. So they have helped in defining which are what is the grid, to profile the vulnerability of people. It is internal. We will check whether it is. You can go on the website and you will see whether the deliverable is public or not. There is a section on the deliverables. Sorry for this. I cannot remember in this moment whether it is public or not. However, we will also publish articles, etc. on this. So.
Yes, just to give you the reference, is deliverable 2.2. So as Pasquale said, I think it's public, but please check.
Okay.
Second part of the question, to update the risk graph. So at the moment, of course, it can be updated in the sense that you can add links if you see they are not in the system. But at the moment, this is not done through the Visual Analytics environment. So basically, it should be done at the level of the inputs collected. So for example, if you see that there is something not drawn in the visualization, you can modify the files that the system is taking an input, in particular at the business level and at the human level. If you think this is an interesting functionality, we can think about how to include it in the system.
Sorry,
Yes, I think it's interesting to be able to at least some roles to make some edits using the GUI.
Okay, and I am glad to tell you that the D.2 is public, so so you can read more on this concept.
Thank you a lot. Thank you for the info.
But you just go on the website and you will find it easily. Okay, let's go with the other questions. Yeah.
There is the third part of the question. So the effort needed to apply the response, yes, is taken into account when you identify the cost of the mitigation action. So as Martina said, maybe she can explain better than me, but there will be a cost associated to every mitigation action that is taken into account. And the effort is one of the components that contributes to the quantification of the cost.
Okay, because I heard that it will try to apply the minimum responses or minimum mitigations, minimum number, and not which is not always the good metric. In general, we think about the cost more than the number.
Yes, yes. In the last slide, I said that the first choice is the best combinations taking into account budgets. So this is the first parameter that we consider in order to do the mitigation, to do the combination ranking.
Maybe I think Wissam is trying to highlight that one thing is to take into account the budget, something else is to take into account the cost to apply some mitigation action. I think we are considering the cost of each mitigation action. I don't know if I identified correctly.
Yeah, exactly. It's not only the budget, because we need also time, we need to train people, we need to do a lot of things. Yeah.
Yes, and
this is taken into consideration. No?
We consider both direct and indirect cost. Indirect costs probably are related, for example, for human training, there are indirect costs that are related to time used by people of the healthcare organization that has to use their time in order to perform the learning and not to work, for example.
Yeah, I'm thinking, for example, if the response need to change a little bit the process in a hospital, this will imply that people will change how to work, and this sometimes it's not very easy to apply because of course a lot of people will be against changing their way of working, for example, and
yes, you're right. You're right. You have to consider that after all, this is a tool that is a support, decision support tool. No? So you can add also other things that in the consideration that cannot be structured, no, and modelized in a tool.
Okay, maybe a last recommendation, because I see that you have very nice graphs and very nice risk management tool with a good UI. Maybe there is a need to have a kind of how we call that? It's an agenda to explain what are the meaning of icons, what are the meanings of colors that you use in the GUI.
A sort of help online.
Yeah,
okay.
Yeah, exactly.
Yes, this is good. Yes. Okay, so let's go on with the other point. There is another question from Hani. What would the risk outcome report look like for a business stakeholder? And would they understand, where is it? Would they understand what the tool is telling them? Fabrizio?
Resilient response engine is still under development. Let's say we have an idea of what to show. I think I have also a slide. No, I don't have available. But to be honest, it's not yet very, very clear what we can show. Of course, a report in terms also export some reports after the finalization of the computation can be an option as well. Let's say that technically is not part of the requirements, but your opinion is very welcome on that. I don't know if you have something to suggest. I don't know if
Fabrizio. Thank you for your intervention. I guess, you know, the reason I'm asking these questions, I've been in cybersecurity for the last 20 years. One of the biggest issues when it comes to launching a cybersecurity program is often convincing the senior stakeholders that there's something necessary to be done. And typically one of the biggest failures of our profession is that we fail to articulate what the risk is in business language. Now, here today, I've seen a wonderful tool, very capable, lot of thought went to it at a technical level. But I think what it still doesn't address is how do we present this wonderful intelligence that goes inside the machinery of this tool in layman business terms, so that the decision makers can then provide the funding for it. Because, and that's the another point, the tool makes a decision on which mitigations are relevant based on the funding and the budget provided. But that's actually a bilateral equation, because sometimes if you communicate the risks properly, you will get the funding you want. It's not a one-way variable, if you like. And this is again part of the dilemma I'm seeing here is, yes, it's great that you take the funding as a parameter in the outcome of this tool, but sometimes if we are just able to communicate the message properly to the decision makers, then the funding could equally alter as a result of that communication. And this is where, again, I'm not seeing this here, or maybe the tool is trying to do too much. That's another way of putting it from my perspective. And I don't know if that's helpful or that's a bit negative. I don't know.
Thank you a lot. I understand very well what you are telling. And of course, for sure, we should simplify the visualization of the result, despite if it can be a report that you can export or whatever. I think it's very important that even if all the functionality, the capabilities that Simon explained, that are, it's clear that are very technical. So to convince to have the right budget to implement the mitigation actions. So really to take advantage of this tool, we need to think about simplified response view, something that can, even if...
Absolutely, Fabrizio, because at the moment, I just feel that it's a tool by security specialists for security specialists.
Yeah. Let me just tell you something more, because maybe it's not can be not very clear from the presentation of our demo. Simone showed that all the stuff, whatever you can do with the tool, but there is as I was telling at the beginning, an automatic computation. If there is some changes of the network, there is a generation of new snapshot, and then the computation starts by itself, and is proposing. The idea is to propose the to alert the end user in front of the tool, or we should think about the potential notification, and just to alert him that there is a new situation, so a new risk evaluation that has been done with related proposed response plan. Very simplified view. I think this can, my personal opinion, can be the next step but there is also this automatic computation is not really needed, that someone should query in that very technical. This I think it's really for advanced risk analysis. I agree. I don't know, Silvia, if she wants to add something on that.
No, I perfectly agree with the comment. So these tools most of the time will be used by technical security operator. Then, of course, what is still lacking is a view for the manager, because basically the view for the manager needs to aggregate the information that we provided today. Because as you said, the manager does not care about the number of paths or the number of vulnerability. He cares about how does it cost and how much can I gain from the investment, basically. So I think that what is still missing here is this level of granularity. So raising the level of granularity to convey the information also to the manager. So this is something that is still missing here. I agree with you.
Okay, let's move to the last question that I see here. I suppose this is for you, Silvia. You assign probability the risk of
the risk
of the
Yes, and in the sense that here there are two types of information that you can play. One is the impact, one is the probability. So the impact that Simone changed, typically this is an information provided by the expert. So he inputs together with the business information, its personal evaluation of the impact. So this is something that the system is not going to infer automatically. The other things that you can change is the probability of an attacker starting in a certain point. So this is something that partially we are covering with a component of the system that is called Context Inference Awareness Engine that we didn't demonstrate it today because it's still under development. And this is why you saw numbers apparently magic numbers because we encoded for the sake of the demo, but at the end there will be a component that will take the graph and the relationship and will try to identify the source and assigning them a probability. So today this is hard-coded and 0.5 is a number that we put inside, but there will be a component in the architecture that is taking care of it. So it will take the graph, analyze the graph, analyze the relationship between the vulnerabilities and nodes, and then he will assign the probability. So we are still developing this part. So hopefully in the next demonstration, you can see also this part.
Yeah, the next demonstration should be in spring next year. Okay, so let's move to the, I hope the answer could be satisfying. Okay, let's move to the next step because we have prepared a poll for you. So I ask Stephanie if we can launch the poll.
Yeah, I would say to Christina, we can launch the poll. Yeah, the first of the polls on the feedback. Okay.
Okay, so the purpose of the poll is of this questionnaire, let's say, is to get feedback from you on a variety of aspects, on the need for improvement for what we have proposed, on how innovative you think is what we have proposed. Okay, it is a structured questionnaire, and we ask you some minutes of attention. It could be very important for us to get your answers. So, Christina.
Thank you, Pasquale. So I move on to the first question. Based on your role and field of expertise with reference to what has been presented, would you suggest some fine-tuning? You can start voting. Thank you.
At which stage are we, Christina?
We're currently at 76%, and people out of 13 have voted, so we'll wait a few more seconds, I guess, and then we'll...
You are eliminating from the calculation our colleagues, yes?
Yes, yes, yes.
Okay.
Okay.
Yeah, okay, off we go, yeah.
I'm now sharing the results.
Yes.
As you can see, 45% of you have some suggestions.
Okay. Okay, where we see some suggestions, this means that we should go deeper, and we have not the time to do it now, and we will ask you kindly to answer in the next days. We will ask you to be more clear and even shortly to give us the suggestions that you are speaking about. Thank you for this. Okay, we can move to the next question. Christina.
Yes. I'm moving to next one. Based on your role and field of expertise, what do you think of DRMP in terms of its usability by intended users? Is it difficult to use, or usable with some effort, or very easy to use? You can start voting. Thank you. Just a few votes missing, and then we're ready. Okay. I'm now ending the poll because two people missing are from our consortium. So I'm here, and I'm going to share the results. So according to 64%, so 7 of you, it's usable with some effort. 18% voted for very easy to use, and 18%, two people voted.
Okay, so a perception of complexity has come out. Okay. Okay, let's move to the next one.
Yes. Okay. Based on your role and field of expertise, what do you think of the DRMP in terms of its usefulness? It doesn't solve any current issues or not very helpful. It may solve some issues, or it's very useful. I think we are missing just one more vote.
Okay, maybe we can close.
Okay, so 73% I think it's very useful, and 27% that it may solve some issue.
At least this. Okay, good. Okay, let's move to the next one.
Thank you for going to the next one. Based on your role and field of expertise, to what extent is the DRMP capable of capturing the specific context of healthcare environments? It's a specific, it has some limitation, it captures many but not everything, or it fully captures the healthcare context.
when we say specificity of healthcare, we mean the fact that there are medical devices that are connected, that there are workstations, many users, and professional people that have an adverse position versus the cybersecurity, or I mean, because they give preference to, obviously, to their mission, no, to save the life of the people.
Thank you, Pasquale, for clarifying. We still miss one more vote, and then we can close this poll too. Wait a few more seconds. Okay. I'm ending the poll, and I'm going to share the results. Okay, so 73%, it captures many, but not everything.
Okay, so it will be interesting to understand what is perceived as a missing thing. Okay, let's go to the next question.
Yes. Okay, based on your role and field of expertise, what do you think of the DRMP in terms of completeness of functions? No or very little coverage, some coverage, but some functions are missing, or you consider it to have a full coverage of all key functions?
Christina, how many questions are still missing? I mean, after that, this one.
There are just a few polls on the innovations compared to the
Innovation,
state
two
of the art.
questions.
Yeah.
Two, 3 questions. Okay.
So yeah, we're okay. We
Okay,
might
so-
run
so
over a
let's
few
see.
minutes, Pasquale, but we're doing okay now for time.
Yes, exactly. So, Christina, if we can.
Yes, I was waiting for one more vote. So just a few
Maybe it is better to cut.
Okay, so I'm going to end the poll and I share the results. 30% full coverage of all key functions and 70%.
Good. So we have to ask also details on this. Okay, good. So let's move to the next one.
The next one, this concerns value added versus state of the art. So
Yes. Yes, exactly. This regards how much is different from the past and from the current market offer. Yeah.
So we're going to ask you to rank the DRMP in terms of its innovations compared with similar solutions that you might be aware of. I'll read the options. Is it behind other solution? Is it like other solution? Or somewhat innovative or more innovative?
Okay, status.
We still have one more vote missing.
Okay, let's cut.
Okay. So I'm glad to share this result of 70%. I think it's more innovative and 30% somewhat innovative.
Okay.
Thank you for that. Moving on
Thank
to
you for this, and let's move to the next question.
again on the added value. please rank DRMP in terms of its usability by intended users compared with the similar solutions that you may be aware of. Is it less usable? It has the same usability, a bit more usable, or definitely more usable? Okay, we're just missing 2 more votes here, and in a few seconds I'm going to close the poll. Okay, I'll land here and I'll read the results. So 11% it is less usable, 33% answered it has the same usability, 11% again, so 1% it is a bit more usable, and at 44%, it's definitely more usable. I'm moving on to...
Okay, there are some variations, interesting. Okay, now is the last question or?
2 more questions.
Okay, okay.
Again, on the added value. We're asking you this time to rank the DRMP in terms of its usefulness compared to the similar solutions you are aware of. Maybe we duplicated the same, or is it my impression?
No, this one's about the innovation.
Okay.
Yeah,
Yes, exactly. This is a comparative, let's say. Okay.
Anyway, Pasquale, Stephanie, I just put in the chat for all the attendees also the link to access our online survey, so they can, after the workshop, if they are so kind to participate to the survey, we can collect additional feedback from them.
Perfect, thanks a lot, Fabrizio. Yeah, that would be really appreciated.
Okay, so we circulate this link also via email, or?
Yes, yeah,
yeah,
we can send
yeah.
I think we can stop at 10, Chris, yeah.
Yeah.
It's a good number.
And I just read a comment suggesting the option no opinion to each poll. So thank you for the comment, and we'll implement this for the next polls. I'm ending now and I'm sharing the results. 50% it's definitely more useful, and 40% think that it's a bit more useful, and 10% think that it is on the same level.
Okay. That seems a good result. So, last question.
Yes, we have one more question for you. Based on your role, please rank the DRMP in terms of the completeness of functions compared with the similar solutions you are aware of. If it's less complete, or if it has the same type of functions, it's a bit more complete or definitely more complete. Okay, I see 8 votes. Maybe I'll wait 2 more seconds and I'm closing the poll. Okay, I'm ending now. Sharing the results, 13% think it is less complete, 25% is a bit more complete, and 63% think that it's definitely more complete.
Okay, thank you very much for answering and also for having attended this this conversation, this workshop. I suppose that Fabrizio, Silvia, and the team have collected a lot of input, and I think that if you give us, let's say, more precise answers to the link that is shown now on the chat, I suppose that this will be very helpful for us. I thank you a lot. I thank you a lot on behalf of my colleagues. Stephanie, if you want to close with...
Yeah, I'll just bear with us 1 second. We just wanted to give you a bit more information about PANACEA, what's next. We'll be meeting quite a few of you again very soon on the tours. But just here's a note on how to join our LinkedIn community if you're not already a member, or connect with us on Twitter. This is also could be a nice opportunity for Sphinx and Curex. We have a Look At Watch that collects reports and guidelines on research on the market trends, on the policy, EU and global. So if you've got anything you'd like to share there, please just get in touch with us. If you go onto the link onto the watch, you will find all the contact details. And just a heads up that Sabina will be presenting at the Connect University Autumn School on Digital Health. This runs from the 21st to the 1st of October. It's all virtual. It will be available in live streaming. And Sabina will be in the session on cybersecurity, a priority for healthcare delivery, and that's on the 28th of September from 14 to 1600 hours. So we do hope that beyond joining us again for the other webinar sessions, that you'll also be able to connect and listen to Sabina in that occasion. She is on the same panel as the interim head of Directorate H at DG Connect, and with also an expert from ANISA. So, and the head of the Portuguese National Cybersecurity Centre. So I think this is a really nice session for people also to follow through the live streaming. So thank you very much. We really appreciated you coming on board this afternoon. We'd really appreciate if you could take that little bit more effort in replying to the survey that Fabrizio has highlighted in the chat. And we hope as well, we look forward to keeping to staying connected and sharing opinions, and to help to take so that we can really build on the support that you're giving and the excellent feedback. So thanks again. So see you soon. Just to let you know that the recording will be available online along with the presentations, etc. afterwards. So we'll keep you posted on that. Okay, thanks again. Bye for now, guys. Take care and stay safe. Bye bye.
Thank you.
Thank you very much.
Thank you.
Bye bye.
Thanks
Thank
a
you
lot
a lot.
to all of our partners as well.
Thank
Great
you.
job.
Bye bye.
Thank
Bye
you.
bye.
Thank you.
Bye bye.
Bye.
Bye.